Hi guys, today we will talk about the standard precaution and transmission-based precaution. So what is a standard precaution? Standard precaution are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status of the patient, in any setting where healthcare is delivered. These practices are designed to both protect DHCP and prevent DHCP from spreading infection among patients. The use of standard precaution is also applicable to the essential for many non-healthcare settings such as personal care and body art industries. Next is standard precaution consists of the following practices. First is hand hygiene. The aim of hand hygiene is to reduce the number of microorganisms on your hands, particularly transient flora, which may present the greater risk for infection transmission. And the second one is the use of personal protective equipment like PPEs, masks, and gloves, and etc. Third is the respiratory hygiene or cough etiquette. Number 4 is sharp safety. Number 5 is safe injection practices and sterile instrument and devices. And last is clean and disinfected environmental sources or surfaces. And the each element of standard precautions is described in the following sections. Education and training are critical elements of standard precautions because they help DHCP make appropriate decisions and comply with recommended practices. When standard precautions alone cannot prevent transmission, they are supplemented with transmission-based precaution. So next is the second tier of infection prevention or the transmission-based precaution. Transmission-based precaution are required in patients known or suspected to be infected with highly transmissible or epidemiologically important pathogens, in which standard precautions may insufficient to prevent transmission. Transmission-based precautions or TBPS are used in addition to standard precautions when standard precaution alone may be insufficient to prevent transmission of infection. TBPS or the transmission-based precautions are used for patients known or suspected to be infected or colonized with epidemiology important or highly transmittable pathogens that can transmit or cause infection. There are three different types of transmissions. Transmissions or transmission precautions. First is the contact precautions, used for infections, diseases, or germs that are spread by touching and patient or items in room. And contact precaution refer to infection prevention and control interventions to be used in addition to routine practices and are intended to prevent transmission of infectious agents including epidemiologically important microorganisms which spread by direct or indirect contact. So this is the example of contact precautions. First is the viral gastroenteritis or Clostridium difficile and scabies. Next is the droplet precautions. Droplet precautions used for diseases or germs that are spread in tiny droplets caused by coughing and sneezing. The example of droplet precautions is influenza or pertussis or whooping cough or rubella. Third is the airborne precautions, used for diseases or very small germs that are spread through the air from the one person to another. The example of airborne precautions is pulmonary tuberculosis, chickenpox, and measles. Next is standard precautions and transmission-based precautions. The standard precautions are the work practices required to achieve a basic level of infection prevention and control. Standard precautions are the minimum infection prevention and control practices that must be used at all times for all patients in all situations. Transmission-based precautions are used when standard precautions alone are not sufficient to prevent the spread of the infectious agent. And last is transmission-based precautions are based upon the mood of transmission of infectious agents. The standard precautions are the minimum infection prevention and control practices that must use at all times for all patients in all situations, while transmission-based precautions are used when standard precaution alone are not sufficient to prevent the spread of an infectious agent. So that's all for today.